An educational approach to AIDS. AIDS, or acquired immune deficiency syndrome, is a disease which has been classified and defined only recently and has resulted in a great deal of fear, confusion, and controversy. Knowing the facts can help you talk intelligently about AIDS, dispel many of the myths which have arisen since the first cases of the illness were described, and protect yourself from contracting the disease. In the United States, the first cases of AIDS were documented in 1981. The number of reported cases of AIDS has increased steadily. This increase has prompted health officials to concentrate on controlling and eventually eliminating this new and often fatal disease. AIDS is caused by a virus. It is believed to have come to the Western world from Africa, where it may have originated. The African green monkey carries a virus that is very similar to the AIDS virus. The AIDS virus has been given different names by different research groups. HTLV3, or human T lymphotrophic virus type 3, LAV, or lymphadenopathy-associated virus, ARV, or AIDS-associated retrovirus, and HIV, or human immunodeficiency virus. Although different names have been given to this virus, they all refer to the same causative agent. Studies have revealed that AIDS is caused by a specific type of virus called a retrovirus. Retroviruses differ from other types of viruses in their genetic makeup. While many other viruses have a single or double strand of DNA, retroviruses have a single strand of RNA. Retroviruses use the enzyme reverse transcriptase to make a DNA copy of their RNA. The new DNA copy is incorporated into the host cell's DNA. The viral DNA is then replicated along with the host cell's DNA. Thus, the host cell has actually been converted into a factory producing new AIDS virus particles. Individuals with AIDS have a paralyzed immune system, making them susceptible to diseases which would normally be conquered or prevented altogether by the healthy immune system. A basic understanding of the immune system is therefore essential in understanding how AIDS affects an infected individual. In the healthy immune system, many cells work together to combat infectious agents after they enter the body. Lymphocytes are a major group of cells which help to regulate the body's immune system. Lymphocytes are divided into B cells and T cells. T cells are divided into T helper cells and T suppressor cells. T helper cells have many different important functions. One of these is to stimulate B cells to produce antibodies, which seek out and eventually destroy an invader, such as a virus. Once the invasion is under control, T suppressor cells respond by calling off the attack. At this point, the T helper cells are hindered from stimulating the antibody-producing B cells. Here you can see what happens once a virus has entered the body. Notice how many different cells, rather than a single type of cell, work together in combating the disease. The AIDS virus is unique in the way it seeks out and attacks the T helper cells. It greatly depletes the number of T helper cells, leaving the immune system powerless against diseases. Without sufficient stimulation of B cells by T helper cells, there is a severe lack of normal antibodies. Thus, without the T helper cells, there is nothing to switch on the body's immune system. In a normal immune system, there are about twice as many T helper cells as T suppressor cells. In an individual with AIDS, the ratio is much lower, that is, many fewer T helper cells. Thus, an individual with AIDS becomes highly susceptible to diseases because the immune system lacks a sufficient number of immune cells and a sufficient amount of antibodies, and thus lacks the power to fight infections. Studies of how the AIDS virus is transmitted have revealed that certain individuals are at a greater risk of contracting the virus. At greatest risk are members of the homosexual community who practice sexual acts such as anal intercourse. This act promotes the exchange of body fluids which may contain the AIDS virus. The part of the body most likely to be damaged by anal intercourse is the delicately lined rectum. Anal intercourse can result in the tearing of delicate tissue lining the rectum, and thus become an area of easy access to the bloodstream for a virus like AIDS. The AIDS virus is far less likely to infect an individual during heterosexual intercourse because of the lining of the receptive area, the vagina. Its walls are thick and durable, and provide an excellent defense against infectious agents that may be transferred into the vaginal area. Others at a greater risk of contracting the virus include individuals who share used needles, which may have been contaminated with blood containing the AIDS virus. The sharing of unsterilized needles in this way is common among abusers of intravenous drugs. This accounts for the reason why abusers of IV drugs are considered a member of a high-risk group, currently second only to homosexuals. Other ways in which the AIDS virus may be transmitted include transmission through blood or blood products and from an infected mother to an unborn or newly born child. At this time, there is no conclusive evidence that the AIDS virus is transmitted by casual contact. Although an individual may contract the AIDS virus, studies have indicated that he or she may not develop noticeable symptoms. Other individuals who contract the virus may develop a milder form of AIDS. This milder form is referred to as ARC, or AIDS-related complex. ARC is a syndrome which often occurs in individuals prior to the occurrence of AIDS. The characteristic symptoms of ARC include enlargement of lymph nodes, referred to as lymphadenopathy, fatigue, fever, weight loss, recurring diarrhea, and intense sweating at night. Although not everyone who possesses ARC will develop AIDS, this abnormal complex helps physicians in determining if an individual is a candidate for AIDS. Physicians and researchers observe distinct abnormal diseases in an individual who is suspected of having AIDS. Studies indicate that the majority of patients with AIDS develop certain rare diseases. One of these is Kaposi's sarcoma, or KS. KS is a type of cancer which may appear as a bluish or brown lesion on the surface of the skin or inside the mouth. These spots usually remain, become larger and elevated, and may eventually affect other parts of the body. Another rare abnormality which often occurs in an individual with AIDS is Pneumocystis carinii pneumonia. This is a serious protozoan infection of the lungs, which usually causes fever and difficulty breathing. An individual infected with AIDS often displays one or both of these two diseases. and may develop other infections referred to as opportunistic infections. These are infections which tend to occur more readily when the immune system is suppressed. They take advantage of the immune system's inability to fight back. Such opportunistic infections are caused by many organisms, including viruses, protozoa, bacteria, and fungi. The presence of KS, Pneumocystis carinii pneumonia, and opportunistic infections in a patient provides the physician with clues which may point to the diagnosis of AIDS. Another way a physician can diagnose an individual as having AIDS is by testing the individual's blood for antibodies to the AIDS virus. This is currently being done using various testing methods. For example, the antibody detection test kits, which are manufactured by private industries. A positive result with one of these tests does not indicate, however, that an individual has AIDS. It only indicates that the individual has been exposed to the virus at some point in his or her life. Testing blood for antibodies to the AIDS virus has helped not only in diagnosis, but also in screening large quantities of donated blood which may be used for medical treatment. All blood donation centers in the USA now screen donated blood for the AIDS virus. The antibody detection test kits currently being used are highly effective in identifying positive samples. Donated blood which is identified as positive for the AIDS virus is rejected. This has greatly reduced the chances of the virus being transmitted by donated blood. Screening of donated blood is one method which helps prevent the spread of AIDS. Other measures which have been suggested are directed to the individual. These measures include the following. Do not have sex with anyone known or thought to have AIDS or to be at high risk for AIDS. Do not have sex with a number of different partners, especially those individuals who you don't know, since this may increase the chances of encountering an individual infected with AIDS. Do not abuse the use of intravenous drugs. If you must use IV drugs, never share needles. Do not have sex with anyone who abuses the use of IV drugs. And persons who are at risk of contracting the AIDS virus should refrain from donating blood. Although preventive measures such as these can help to control the spread of AIDS, there is an urgent need for a cure for the disease. At the present time, there is no cure. Although no drug has been produced that can restore the immune system of an AIDS patient back to full capacity, there is treatment for some of the diseases associated with AIDS, such as Pneumocystis carinii pneumonia and certain opportunistic infections. Many experimental drugs and vaccines are in the developmental and trial stages. Vigorous research is being performed to produce both a drug for treatment of the disease and a vaccine which would control the spread of the virus. Many misunderstandings and questions have arisen about AIDS. There are many organizations which can answer questions and provide information about this new disease. A few of these organizations include the Centers for Disease Control in Atlanta, the U.S. Public Health Service, which has a national AIDS hotline, the San Francisco AIDS hotline, the Washington, D.C. AIDS information line, and your local Red Cross and Department of Public Health. It is important to be informed about AIDS. There are many myths which surround this new disease, and the best way to avoid being misled and perhaps protect yourself from contamination is by staying informed.